Our plans in Hong Kong are very much to grow by organic growth and not by acquisition. But China is a very different subject, and it's one that is taking a lot of time to uncover what's the right way to go about it. But if an opportunity came up in terms of acquisition or startup, that's what we're looking at. We opened an office in China middle of last year, and we're looking at all the options that are around. And I think the China market's still very new, very young, and we're experiencing what are the issues with hospitals, what are the issues with the demographics of the population, what are the locations to work in. So we're looking at all of those, and hopefully we'll come up with some insurance products in the next few years. It's very interesting. SARS was a good increase for us as insurance companies, because people looked towards insurance as a result of SARS. And I think you get these stimuluses every now and then, SARS, bird flu, government reform on healthcare, these sorts of things. It tends to be around when people have got something in their life which triggers them to think about health. So for example, illness from a loved one or death of a loved one, those sorts of things do trigger people, and SARS was one of those that triggered people to think about health insurance. Personally, I don't. No, I think a lot of people have health insurance, medical insurance, but actually not to a sufficient degree that means that they'll be covered for the expenses. And health insurance in Hong Kong does tend to leave people with quite a big shortfall. That is the difference between what an insurer will pay and what the costs of treatment are. And Hong Kong's an expensive place for private healthcare, so you've got to look for a plan that covers the costs of private healthcare, such as ours. The most commonly seen complaint I've seen in the market and with ourselves is people who make an insurance claim for a checkup. Where they go into hospital, they'll have some tests done, not necessarily a confirmed diagnosis, but they'll be having routine tests and a checkup, and they'll claim for that on their insurance. And when the insurer rejects that as a claim, they then get a complaint coming through, why didn't they cover it? And insurance doesn't cover checkups, it covers acute illness and injury, and that's where we put our energy and effort.